The Ministry of Health has shown fear due to the increasing death cases and new cases rising. According to the Director General, the rate at which these cases are increasing calls for serious and quick response.
The most affected group this time, the age group, is 20 to 39 years old. And that during this period, the intensity of severe and critically ill COVID patients is higher than it was in the previous first wave of the pandemic. So in this wave, the severity of the conditions is higher. In the first wave, it took 3 to 4 months to get to the full-blown epidemic. But in this case, it has taken us less than 10 days to rise to the highest level.
He further highlighted on the COVID cases which have caused the rate to increase tremendously.
It's taken us less than 10 days to rise to the highest level. The increase in number of cases coupled with deaths is largely due to compliances in adhering to COVID-19 public health preventive measures. As many of you will know, the problem we are having, if you go to markets, the way people are behaving without any masks, without any hand washing, and the crowding in markets. If you all know about the parties which are going on with so many numbers, over 1,000. You all know about what is happening in funerals extending to 2,000 people.
Kampala and Wakiso are among the leading districts with high numbers of cases, and that doesn't mean that the other districts are safe, according to the Ministry of Health.
Kampala, Wakiso, Gulu, Amuru, Moroto, Arua, Mbale, Masaka, Oyam, and Kalungu. Those are the districts which have reported the highest cases of numbers in the last 14 days. However, this does not mean that other districts are doing well. Actually, what it may mean is that those districts are not testing and are not vigilant, are not carrying out surveillance, and not reporting.
Recently, education institutions resumed their operations. However, they are currently unsafe. And according to the ministry, there are cases reported in some academic institutions caused by not following the standard operating procedures and overcrowding of students. They have therefore called upon administrators to report any case and suspicions of COVID-19.
A total of 29 schools from 17 districts have recorded a total of 803 cases and 1 death. That's in schools. 803 cases, 17 districts affected, and 29 schools. That was a week ago. The affected schools include 10 nursing schools, 11 secondary schools, 7 primary schools, 1 PTC, and 1 tertiary institution. Some universities have also reported cases and are under investigations. The main drivers of transmission in these schools are usually overcrowding and certainly non-adherence to SOPs.
On the side of travelers, the ministry has categorized them differently and banned those coming from India.
Aircrafts in a state of emergency, if it is originating from India, overflying our airspace, but is in a form of an emergency, certainly they are allowed to land. Also, operations related to humanitarian aid, medical evacuation, and diplomatic flights approved by the appropriate authority. But also important to note that we also have our Ugandans who are going to India for treatment. They are allowed to come back, but of course when they get here, there are some stringent measures. If you are Ugandan, you have to return, but we have to test you on arrival.
The second category, involving USA, Kenya, Ethiopia, and others, have also been urged to follow the set guidelines.
These travelers from Category 2 countries, these are USA, United Kingdom, United Arab Emirates, Turkey, South Africa, Ethiopia, Kenya, South Sudan, and Tanzania. Any traveler from these countries, including Ugandan nationals and even residents in Uganda, will be subjected to a PCR test on arrival at the airport. at their own cost.
On vaccination, scientists have informed that those who have received complete dosage are a little free from being infected of COVID-19. Dr. Henry Mwebesa, the Director General of the Ministry of Health, has urged the public to go back and finish up their dosages, as he called upon those who haven't received their first jab to go for it quickly.
Persons who received the first dose of AstraZeneca vaccine and have completed 8 to 12 weeks should visit again and receive their second dose. We recall initially we had said that let's first go with first dose. But now we have allowed people to come for their second dose. So to this effect, administration of the second dose commenced on 21st May 2021. That was exactly 6 days ago. So all those who are eligible are encouraged to ensure that they access the vaccine from the nearest vaccination point.
The Permanent Secretary, Dr. Diana Atwine, has reacted on the cases in babies.
Now, this business of saying, for me, I'm young, I don't have any hypertension, I don't have diabetes, therefore I am safe, even if I don't get vaccinated. I think that notion should get out of our head. We make sure that all of us take precaution and make sure that we avoid infection, because you do not know how your body will react, even when you are young, even when you don't have any comorbidities.
People are more socially active, and they go out, they interact more with others. As a result of that, their risk for exposure is high. But it is important to understand that the genetic background that makes the person who is 50 years old to have diabetes and hypertension is present with us even when we are young. So it seems that COVID-19 more or less excavates that background.
In the same line, the World Health Organization representative in Uganda has commented on forging of travel medical documents.
Talking about forgery of test results. We are talking about forgery of vaccine certificates, or vaccine books, or vaccines notices. So what we tried to, I think the criteria which Uganda is using here, which says that we only take people who have been, we only accept vaccination cards from countries which are over 50% vaccinated, is also an effort to ensure that the vaccine certificates are also genuine.
The cumulative cases stand at 44,594, active cases stand at 194, and the death toll is at 361. This report has been compiled by Isa Chigongo for Channel 44 Prime News.